Cool. So we're going to get rolling here. I'm going to open up with the state of private practice PT. And for those of you that are just tuning in, I did find some new things that kind of surprised me, but we're going to go through, see what is happening right now in private practice PT, and then ultimately we're going to talk about what we can do about it. So industry outlook, this number is unchanged. If you were on our last virtual summit, 50,883 integrated private practices. So that includes physical therapy, occupational therapy, speech, audiology. I can't find another number other than that, but that seems to be where we're at. What is new is 90.3% are considered small owner operated clinics. So these can have, up to 10, 20 locations, but they're still considered small owner operated clinics. And then roughly 10% are the larger players. So we have a market that's very not consolidated yet. I know there's a lot of talk about private practices consolidated. That's not really true today. And then in Canada, if you're tuning in from Canada, 5,715 private practice physio clinics in Canada. So industry outlook, in total revenue in 2024 was $53 billion. When you look at the number of clinics, and that isn't within the US. So the average gross revenue per clinic or per company is $1.04 million. And again, I think they use multi-location practices in there as well. And the net profit margin is 12 to 20%. Now, I read an interesting article within the last week, and I was going to put it in here, but it was saying the average practice margin in private practice is 30%. I don't see that, but we're going to survey that and get some live data here for you in a second. We're going to break this down into the 4 pillars of private practice PT, and really it's small, medium-sized business across the board. And the 4 pillars are, number 1 is people. So this is our team, how we take care of our team. If you're dealing with raise request or staff retention type issues, this is all going to be in that people system that we have, HR, et cetera. The next pillar is marketing. So this is how we get new patients for us, right? The more new patients has been in our market now for 30, 40 years, right? And I think, this is really for a lot of us, if we look over the last 25 years with the rise of direct access, a lot of us are trying to figure out how do we market direct to consumer. So we're going to talk about that here a little bit. We're also going to talk about finances. I perceive that most of the owners that I talk with have fairly tight margins, right? And it's definitely not getting better from where it was in 2019, where we were 5 years ago pre-pandemic. But we're going to survey that and find out here, and we're going to talk about what we can do about that also in this first session. And then finally, we're going to talk about operations. And, the theme of today is AI, automation, and technology. And I think for most of us as owners, we feel like we're being time starved a little bit, and really what most owners will say is we need systems. Well, how do we do that? So today is all about, for the next 5 hours, 6 hours, we're going to be talking about how you can take advantage of the tools, the AI technology and automation tools that are available in the marketplace, so you're buying yourself some time back. So quick poll, the first thing that we're going to focus on is personnel. So this is your team hiring. Poll is on your screen. Just how easy is it for you to hire PTs in today's market? I know a year ago it was an absolute really rough ride for us. We'll show you why that is in a second, but just select the one that best describes you. We have more applying than we can hire. We get some applicants, but it seems harder than it was before. Whatever we're doing isn't working, or it's impossible. So just select the choice that best describes your hiring condition, your hiring state right now, what's going on for you and your personnel, your team building. And we'll leave that up for another 5, 4, 3, 2, 1. Great. I'll share the answers with you here in a second. Cool. So most common answer was we get some applications, but it seems harder. We're going to have a session specifically on this today. Justin Pizik, unable to join us, but he shared something on our podcast, did an amazing thing, and we're going to share with you exactly what he did later today. The second most common answer is whatever we're doing isn't working. So those two answers make up 76%, that it's harder or it's not working. Whatever we were doing before isn't working. And 19% said it's impossible. Only 5% said we have more applying than we can possibly hire. So we're going to address that here today. Quick look at what is going on for us right now. And this is an update from what I had shared earlier in the year. 2010, 32% of licensed physical therapists were between the ages of 50 and 64. In 2019, that number was 49%. So if you follow the numbers, what it looked like in early 2025, late 2024, is that we had an aging population of clinicians. However, today, updated numbers for that, it's only 24% are between the ages of 50 and 64. We had this tremendous youth movement over the last 5 years. So that was surprising to me, but then unsurprising when I really started talking with other owners and seeing, what was going on. There's maybe some hope in this for us. So projected annual shortage of physical therapists is 18,000 per year through 2030. And last year we had 12,149 DPT program graduates. And what was even more alarming is if they graduated in 2024, which many colleges, universities refer to as the pandemic or the COVID class, they're 5 times more likely to have failed their national exam, licensing exam. So that doesn't mean they didn't eventually pass, but it was a rough run last year. And I know just personal numbers sharing, last year, I think we had 3 candidates. It was the first time I was ever ghosted during an interview process, and it happened twice. So 2 of the 3 candidates ghosted us. Absolutely wild. And yeah, so this was after like a 3-hour interview. And then this year we had 10 candidates, and we had more candidates than we could hire, which was also really, really cool. So nice to see that rebound. So there might be hope for us. And again, we're going to be sharing more on what's working in terms of hiring later on today. The next pillar that we're going to talk about here is finances, your profit margins. So again, you have a poll coming up on your screen. What's your profit margin look like today? So first answer is 25% plus. You're absolutely crushing it. So that would be like if you have $1 million practice, once you factor in your fair market value compensation and everything else, that you have a profit margin of at least $250,000 a year, right? The next bucket is 15 to 25%. The third bucket is 0 to 14%. And then the final bucket is less than 0, that you're losing money. You're having to subsidize the practice. You're not taking pay, things along those lines. And I would think about this for like this year or maybe the last 12 months. So what's your current profit margin? Completely anonymous. So we'll leave that up for another 5, 4, 3, 2, 1. And so we have 37% are 15 to 25%, 43% are 0 to 14. So 80% of us, and wow, there's a lot of people responding here, so this is great. So 80% of us are in that 0 to 25%. We have 13% who are losing money today, and 7% are absolutely crushing it. So high five to those crushing it. Very nice job. Yeah, just to give you some numbers, I know Bob Kowalik will be on here later today in a session this afternoon. The numbers that he had shared were across the 220, 250 companies, private practices that he had worked with. Average margin was, I believe, 14.6% in 2018. And in 2023, that number was 9.8%. And that puts us, anything 10% or lower, we're in a bit of a pickle. And what Greg Crabtree says is that we're a speed bump away from closing our doors. So you can go to the chat for this one, but I just want to know from you, how's your profit margin today versus 5 years ago? So if you look at what's happening in 2025, the trailing 12 months, how does that compare for, if you were in practice before 2020, what did it look like then? What does it look like today? Would love to hear from you in the chat. You can go there now. I'm going to keep moving here just for time, though, while you're doing that. So David said worse. Sean says worse exclamation point. That's great. Brian, much improved. Good job, Brian. You're the outlier here. Lots of worses or lower today. Steven says half of what it was 5 years ago. Lots of worses. Okay, so I just wanted to make sure my pulse was right here. And I agree. What I'm seeing in my own practice, plus other practices, we're in this little bit of it's not really little. It's a large financial crunch, right? So we have to come up with some things to do here, and we're going to cover that all day long here today. So I've shared this before. If you haven't seen this before, we're going to talk about what is happening in the market. This blue line represents what? It represents the physician fee schedule for Medicare. So if you participate with Medicare, or you have insurance companies that use the CMS guidelines or reimbursement schedule, this is what has happened since 2008. So 2008 to 2025, 17 years, there's been a 16% decrease. And in all this time, we've had two increases. So 17 years, two increases. Now, there is another one proposed for 2026, although the government shut down today. Don't worry, we're not going to go political right now. But Mary's going to give us an update. Mary DeLong is going to be on this afternoon and give us an update about what is in store for us, or what we know as of today. But as of right now, there's a proposed increase, albeit a small increase, for 2026. And that'll be our third one now in 18 years. Lots of decreases, not many increases. And if you look at the physician fee schedule from 2025, and I was talking about this with my family last night, if you go back to 1994, which is when I was a junior in high school, hustling from wrestling practice, going to volunteer and shadow in a clinic, most of us had that experience. The reimbursement, the physician fee schedule is lower today than it was in 1994. But the value of the dollar has more than halved, right? So the value of the dollar today is less than half of what it was in 94. So we're really worth less than half. Our services are worth less than half of what they were 30 years ago, right? So we're not moving in the right direction in terms of income. What is this? Well, this is the CPI inflation index, right? We look at, the costs that are burdening us the most as private practice, our cost to provide care. The cost of education has gone through the roof over the last 30 years. I know when I went through Misericordia master's degree, I think my total education might have been $100K. We're talking with DPT students now that have upwards of $250,000 in student loans, right? And they're making maybe double of what I made coming out of school in 2000. However, remember, the dollar is worth half of what it was back then, right? So now they have a crunch. Now they have the same exact buying power that I came out of school with in 2000, but they also have $1,000 to $3,000 a month student loan payment. That's a brutal scenario that oftentimes you get the crux of that, right? You get the burden of having to increase salaries, even though you're facing that graph that we looked at on the last slide, the declining reimbursements over time. So when we combine these, if we look at this, and by the way, I know there's some disagreement in the marketplace. I know this is the number one slide that has been requested for other owners to use, or other people within private practice. Can I use the slide? We say yes, give full permission every single time. And I just went to cms.gov and graphed out the physician fee schedule, and then use the CPI index. However you want to adjust this for the cost for you to provide care, so be it, have at it. I just know that these two lines are getting closer together the farther that we go along, right? So not a good scenario. I know your costs to provide care next year are likely going to be higher than they are this year. I know that reimbursements next year are either going to stay flat or maybe maybe we get that slight bump, but time will tell. All right. So 3 ways that we see owners that are correcting this right now or trying to, fight against it, mitigate it. Number one is they're dropping a payer. We just did this within the last 24 months. Went out and networked with somebody who we were working really, really hard to collect a dollar from. Yet at the same time, they were flat, right? So it cost us a lot of time to collect the reimbursement, the insurance reimbursement, and it just didn't make sense for us long term. So we dropped the payer. We went out of network with the payer. We can also, another thing that we see owners doing is we can attract more higher payers. We're going to talk about that later in this session here this morning. The third thing that we can do is add cash pay and hybrid, become a hybrid practice where we're accepting both insurance and we're also collecting cash pay. We've added 3 cash pay services that are doing really well over the last, I think, 7 or 8 years. I remember when we first started talking about this 10 years ago in private practice, almost nobody had a cash-based service, right? So if you did back then, you were ahead of the curve. Today, everybody's doing this, right? This isn't a new thing. You're late to the party if you haven't added a cash service yet. And what owners are trying to figure out is how do I market this? How do I sell more of this? How do I get more patients to utilize this service, get better outcomes, and it gives me a healthier, safer profit margin of safety, right? So we're going to talk about that here later today as well. And our final pillar that we're going to get into here before we get into marketing is operations. So another poll, third poll here for you coming up. Which EMR are you currently using? So I know a lot of practices. I had mentioned, Steve, and you and I were, on a call. You were the last call that I was on here, just looking for this. A lot of owners are talking about switching their EMR, right? So today, which EMR are you using? You can see the top 4 or 5 are on there. If it's other, you can just hit other and throw that into the chat. But I know this is on the mind in the last few years of a lot of owners switching EMRs. So you have better systems in place. And the other thing that we see here is consolidation, right? Rather than having 20 different software automation technology tools, we want less. So we'll leave that up for another 5, 4, 3, 2, 1. And I'll read you the results here in 1 second. All right, so 33% are prompt, 3% are Raintree. That full transparency, that's what we're on. WebPT is 19%, Athelis is 3%, Jane App is 3%, 39% are other. So we have a pretty fragmented market there across the board. Thank you for participating in the poll there. Yeah, the other thing that we constantly think about, and what I'm doing with our group and what I do when I talk with other owners, how can I scale, build systems when I don't have time? Most of us are time starved, right? It's overwhelming, everything that we have to keep up with. Again, all of the HR, if we just break down building our team, right? So you have hiring, that's getting ads in market, going through the interviews, doing reference checks, anything else that you're doing with your HR movement and processes, the actual hiring, onboarding, training your team, running weekly staff meetings, looking at metrics, hiring, firing, promotion, all of these things that we have, right? Staff development, all of these things that we have, plus add on, most of us are involved in our finances heavily. Most of us are involved in our marketing, and most of us then, with what little time we have left, we're to be building systems and better processes, right? How do we possibly think through that and do that? And we're going to go through a live example here in a minute or two. The fourth pillar that we want to talk about is marketing. So this is, getting more people to raise their hands. There is a marketing poll that popped up on your screen already. So what are you most focused right now on in your marketing? The first one up there, I need more consistency. Maybe you have a slow season that's about to come up here, as many of us do. Second answer is I'm too reliant on physician referrals. I want to learn how to diversify away from physicians and go direct to the consumer. The third one here is I have no time to market, right? I'm busy treating, I can't market, and then my new patient numbers fall down, or maybe I brought on a new therapist, or I opened or I expanded an office, and now I'm not busy, so now I run out and market. Now I'm busy again, right? That's the third one. Fourth is underperforming new clinic or expansion. So maybe you've added existing space, maybe you open a second office or a 20th office or whatever, and you have that, we call it the de novo dog, right? That's the fourth option. So de novo dog means like I open a new clinic, but uh, it's not even at break even yet, right? It's a drain on our other clinics. And the fifth one there is our margins are tight. I want to market more cash services. I want to add cash services. So, by the way, on this one, this is different. If you hadn't hit submit yet, you can pick more than one option, right? So just pick the one that describe or one or five that describe you the best, and we'll leave that up for another five, four, three, two, one. Great. So we have I'll just, yeah, this one won't add up to 100%. So 40%, I need more consistency. That was the most popular one. Next up is our margins are tight. I want to market more cash services. That was 29% of the responders. Next one up is I'm too reliant on physician referrals. I want to go direct to the consumer. That's 27%. No time to market was 24%, and then 21% was underperforming new clinic or expansion. Awesome. So, yeah, we're going to talk. The rest of this first session is going to be how to solve the majority of those. So, very cool. So, when I'm again talking with owners, the thing that I hear most often is we need more consistent new patient flow. So we need that consistency. In our poll that we did here, our straw poll, that was number one, right? 40% of us. But I don't have time to market. Also up there in terms of popularity. And before we get into how to solve that, I just want to take a step back, focus on purpose. What is this really about? Our vision that we've been talking about here at Breakthrough for the last 10 plus years has been flipping the healthcare pyramid. Right now, if we look at what is happening in the US, and I didn't include these numbers, but I know them off the top of my head, roughly $14,584 per year per person is spent on healthcare in the United States. So we have a ton of money going out, right? There's some political initiatives on both sides of the fence right now to try to get that under control. However, if we look at the system that we have today, we're spending almost double of any other country in the world. And yet when you look at any metric that you want to look at for population metrics, right, that indicate healthiness, so infant mortality, life expectancy, rates of chronic diseases like cancer and heart disease, et cetera, US is not in the top 20, right? So most expensive, I would argue least effective of any country, any industrialized nation in the world, right? Brutal. If we look at where that money goes, that $14,500 per year, approximately $1,100 a month, if you want to break it down that way, nearly $1,200 a month per person. If we look at that, where's that money going? It's not going to conservative care. You're not the problem. And by the way, Medicare defines conservative care as physical therapy, occupational therapy, speech, chiropractic care, dentistry, podiatry, and optometry. That is the bucket of conservative care. So if we look at the total amount of dollars that are spent in conservative care per year in this country, it is less than 10%, right? We're not worried about prevention. We have a very reactive system. Nearly 72% of or roughly $800 a month, goes to medications, injections, surgery, diagnostic imaging, those four, right? And our vision here at Breakthrough, the reason that we're doing this is, and our purpose and what we talk about with our team all the time, and also working with owners, is flipping that healthcare pyramid, putting conservative care in its rightful spot. When I look at my 6 children, the healthcare system that they're walking into, it is not sustainable, right? I mean, $14,000 per year, if you want to do like a mental exercise, so if you have a child that's making, let's say, $40,000 a year, roughly $14,000 of that is going just to pay for healthcare, right? That is brutal, right? So I want to build a world, and I think many of you do as well, where conservative care is the foundation for good health. We have a more affordable healthcare system that's also significantly more effective, right? So this is what we're aiming to do. Now, getting back to consistency, um, so how to solve inconsistency. That we drew out of this is our hypothetical clinic, but I think many of you will identify that with this. You likely have a slow season, slow month of the year, right? So for many of us, it's going to be like January and July, or maybe it's December for you and August, or December and June, something like that, right? For those of us in the Northeast, at least where we're at, our slowest month of the year is December. So what we look at is, for the most part, this practice is averaging 60 to 65 new patients a month, except in the slow months, right? And then we drop down to like 40 to 45, right? This is devastating for a practice. And we're going to talk about how to solve this with AI technology and automation. So we want to think about using AI technology and automation to automate repetitive or redundant tasks, right? And this might be a little bit controversial, but I know Carl, the CEO here at Breakthrough, had shared this with everybody. And I see a lot of businesses, companies doing this now, where they struggle with human performance or human performing a task. The first question they ask is, can we automate this task with AI, right? And I'm going to show you how wild this is here in a second. But if we're looking to solve that consistency problem and you don't have time to go out and build a system, right, or hire and train somebody, we can start thinking about automating tasks. And it's alarming how much more we can do with AI, automation, and technology than just a search, right? So the first thing that we want to do is we want to get hand raises, right? If you're about to experience a slow season in December or January, and you're going to have a 20 new patient a month drop, we need more people to raise their hand, right? So we can use automation to do that, and I'm going to show you here in a second. The second thing that we want to do is convert people, those people that raise their hands in our community, we want to convert them over to an appointment, right? It doesn't help us if we have a list of 300 leads or if we get 25 likes on our social media post, right? That doesn't really mean anything. It's eventually we have to take that person who has indicated interest and get them to schedule an appointment. And the third thing that we want to do along the way is once we fill in our gaps, we want to improve our finances. And I shared with you 3 ways that owners are doing that earlier. And we're going to talk about how you can get a little more sophisticated and a little bit smarter in terms of who you're attracting into your clinic. That will influence your bottom line. So if we're looking to solve, attract more new patients before a slow season, so that we have a waiting list going through, there are 5 ways we can do that. I'm going to go through these fairly quick. We have 5 new patient pathways. Number 1 is reactivations. So this is, I treated Mary 3 years ago for her total knee replacement. Now she is having shoulder pain and she comes back in for her shoulder, right? That's somebody who's reactivated. Can be for the same or different diagnosis. We're going to focus the bulk of our time there because most of us, from what I see here in the chat, have been in practice for a while. We have a patient list. Most of us don't know how to use it, though, accurately. So the second thing we can do, really 2, 3, and 4 are all referrals, right? We can have patients referring patients to us. We can have physicians referring patients to us. We can have partners. So these are other employers, maybe a specialty running store. We can have other groups promoting our services. And the 5th thing we can do is cold traffic advertising. We will touch on the cold traffic advertising later here today, but for right now, we're going to focus on reactivations. So if we want to have reactivations, there's really 3 things that must align. One is we have to have a market. Well, we know who that is. It's our past patient list. Now we can get smarter with our past patient list, and I'll share a quick and easy way that you can do that here in a second, but we have to know who we're marketing to, right? So patients who have for example, my example would be Madden and Gilbert PT. So you're one of the 30,000 plus people that are on our past patient list. You might have a patient list of 30 people or 300 people or 3,000 people. The number is not significant, but you know who you're marketing to. You've selected that. The second thing is, and I'm going to skip over the middle here, we should be selecting media that our past patient base is using. So for us here in Central PA, this is surprising. You might want to write this one down, but number one is text. People are responding to text better than anything else, but number one is text. Number two is email. Number three is direct mail. So that's snail mail that we run through the post office, right? So we have to select media that they're consuming. Some of our patients on our list are going to respond to text. That's the vast majority. The second bucket is going to be email. The third bucket is going to be direct mail, right? With those three communication ways, we can get in contact with just about our entire patient list consistently in a way that they're going to respond. And the final leg of the triangle here that must align is the messaging, right? So this is what we're saying. And to be fair, I mean, this is really why I'm in the role here at Breakthrough. Not really, didn't do anything crazy other than I got lucky back in 2010, 2011, where I started studying how to write copy, put words together in light language that spoke well to patients, right? So this is the what to say. If we look at what most owners mess up, and I'll very quick story here for you. When Carl and I first met back in 2012, he was surveying private practice owners while he was the head of online sales at Tesla. This was a project that he was working on. He wanted to help out physical therapy. And one of the surveys that he sent out was, what is the most successful thing you've ever done and marketing your practice? And he got a list of, let's say, 30 things. So there were things on there like a physician newsletter, patient newsletter, physician luncheon, swag items, 5K sponsorship, school sponsorship, billboards, radio, TV, Facebook, email, et cetera, right? That was one bucket. Then he said, what's the least successful thing, the biggest waste of money you ever had in marketing your private practice? He also had a list of about 30 things. When he looked at those two lists, they were the same. And I remember he sent me an email and he was like, explain this to me. How can the most successful things that are working for private practice owners also be the least successful things? And he said, think about this. So while I was thinking about it, he had the wherewithal to go back and talk with owners. And he said, I know you said whatever, the email is the least successful thing. Can you send me one of your emails or print ads or radio? Can you send me an example of what didn't work for you? And as soon as he started getting artifacts in from what hadn't worked, it became very clear that our market, private practice, we blame the media. Nobody blamed messaging, but that's the problem. That is what most people mess up. And again, it's what really helped me along the way in terms of figuring out messaging. I'm going to stop sharing here for a second. I want to do a quick exercise with you. I want to show you this. All right. So I have this in already, but you're going to be able to. All right. You should be able to see my screen. I'm going to use Claude for this. Claude is an AI tool. It is either free or you can, this is $20 a month. I have no affiliation with Claude. I like to use it for a couple different reasons, but I work on projects in here. So you can see, I wrote an email campaign for a newbie, workshop strategy, pelvic floor marketing campaign strategy, working on a lot of different things, but I put in this prompt. You don't have to remember the prompt. I just want to show you how fast this can be. So put this in. We're just going to hit enter. And I'm asking it for one direct mail piece, one campaign of 3 emails, 60-second video script for social media posting, write 2 different text. I know one of the biggest pain points for us as owners is sitting down and writing this. Now, 10 years ago, what I was having to do is if I was writing a piece, well, I can remember the first time I wrote a greatest promotion ever back in 2011. I collected 40 testimonials, went through with a yellow marker, yellow highlighter, pulled out keywords and phrases, went through, endless amounts of courses and books that I had read at the time on how to write copy, wrote out by hand over 100 different of the all-time greatest copywriting pieces ever. Had to do all that. That is gone, right? So you don't need to do that anymore. All that work, that's a relic. That skill set that I have, that differentiator in the marketplace, you and I are on the same playing field today. You can no longer have the excuse that it takes time for you to write copy, to write an email. So this and the time that I'm babbling about all the pain that I went through before, 3 email campaigns. These are pretty solid. 3 email campaigns, a 60-second video script, 2 text messages, ready to implement. That is insane, right? So that just happened in less than 60 seconds with one simple prompt. Pretty straightforward. And think about the time. Now, I'll share something even crazier. Years ago, to build out one funnel would cost about $18,000 in copywriting and would take 6 weeks. We can do that same amount of work today in less than 5 minutes, right? Absolutely insane. 5 minutes at a cost of $20 a month. That's crazy, right? So what I end up doing here is buying myself a ton of time back so that I can focus on other areas in the practice. Again, I love to write copy. I love to write the words and the information, everything else, but it's a relic today. It's not, just hold on one second. It's not nearly as valuable today as what it was before. So the key for you is like thinking about, all right, if I have somebody down the street who that I'm competing with, right, and they're using this, what am I missing out on, right? So the other, right, they have a marketplace advantage that you don't have. All right. There we go. All right. So, and the other thing is like once you have the copy, at least for us, now I have to go through and edit that, which we do. Like we never trust AI and automated copywriting to like blindly, right? So we always go through. I use other editing software, so we have to take that. Then we have to stick that message into some sort of delivery system. If you use like Constant Contact or MailChimp or something like that with your list that's already uploaded, you then have to schedule it and deliver that message, and then you have to follow up, right? So if we're thinking about this, every time in business that we solve one problem, we typically open up the door for 2 more. So in our, at least for us, right, we have now eliminated that problem. Our practice runs on Breakthrough. So within the Breakthrough software that we use for our 6 clinics to market, we can go in and with the click of a button, we can click the GPE that is already written. We can go through and customize it for our own practice. And then again, very simple. It takes us less than 60 minutes to schedule out our email and text campaigns for an entire year for our practice, right? And that's 2 email campaigns a month, 1 text campaign a month for all 6 locations. And yeah, it all customized and everything else. And we're able to do that and save an absolute ton of time. Just one of the promotions, we call it the GPE. If you've read Killer Marketing Secrets, you know that I talked about this. It was a win for our personal practice to eradicate that slow month. But this was Andy, private practice owner, just sent this out. 22 signed up for screens, reactivation appointments. I believe that was within the first week. Here's another one, Chad Beauchamp. You can see he got 16 appointments without any work from his front desk. If you aren't using text, and he did that with a single text campaign, right? If you're not using text in 2025, you're crazy. So first thing that we're trying to do is get hand raises. Second thing that we want to do is we want to convert those people that raise their hand over to an appointment, right? Somebody responds to our text, somebody responds to our email, somebody calls our office. And we want to think about, again, where can we use technology to speed up the process, right? Gain speed, buy our time back. It's easy to overwhelm the team. Years ago, here at Breakthrough, when we launched our first email campaign, I walked in on a Monday morning in this office, and I know Deb and Jill at the front desk were like, "Hey, you got to shut it off." And I said, "What are you talking about?" And they said, "Whatever you sent out." And I said, "I didn't send anything out." And they said, no, you sent something out. And I said, "Show me what you're talking about." And we had 221 email responses over the weekend, and the first 48 hours from a single email campaign, right? Our team was overwhelmed. They had 150, 180 visits to process on that Monday morning, do the intake, everything else, with all the evals, answer phone calls, follow up on scripts, et cetera, do pre-authorization, everything else. They didn't have the time to follow up with 221 people. This is a problem for us in the industry, right? So once you get that marketing right, once you have effective marketing that is going to raise hands, it's easy to overwhelm your team. And what you want to do is think about, how can I use AI and technology to give my team the tools so that I'm protecting their time, right? If you have somebody at the front desk, your office manager, who's not only handling scheduling, but also handling billing, and now you're expecting her to go work that AR bucket that's over 30 days old, right? And now she has to follow up with 20, 30, 200 people. One of those is going to be sacrificed, right? And usually it's going to be following. So now you just sent out really effective marketing. You've got a ton of hand raises, but she doesn't have the time to follow up with those people, right? She's overwhelmed, right? Because you want her focused on the highest leverage activity, which is going out and working that AR, collecting money for services that you've already provided, right? So we want to give tools. In our practice, we use something called Emily. And Emily is an AI conversion agent. I'm going to exit one more time here, and then we're going to bring a few owners on that are using Emily right now in their practice. But I'm going to do a quick example here for you, a quick demonstration of how well this works. So, all right. Cool. So, yeah, this is just a demonstration. So we'll go through this. How are you feeling? My shoulder's bothering me. And again, most owners misunderstand that this is like a chat bot where it has like a decision tree. This is not a chat bot. It was trained on Chris Voss, the Never Split the Difference FBI negotiator, and it's trained on how to have a conversation with a person that's interested. Really sorry to hear that about your shoulder. Guest, it doesn't have my name. Can you tell me a little bit more about the pain you're experiencing? Is it a sharp pain or more of a dull ache? Pretty sharp. Sorry to hear that you're dealing with a sharp shoulder pain. That can be really discomforting. How long has it been going on? About 3 weeks. And what Emily will do is constantly go back and forth between asking questions, that it's called mirroring, validating what I'm saying, right, or restatement, and then asking another question. These how or what questions that you see here, they're called questions of deferment. So years ago, Carl and the team here at Breakthrough, they ran a call center and looked at tens of thousands of conversations of people who converted. There's an error in the marketplace right now that it's all about scripting, about what we say. Conversions don't happen from scripting. They happen from your practice asking really good questions, but those questions take time, right? So I'm going to exit back out of this. Right. Right. So if we can automate this, which our practice does now, what happens is that Emily's working 24/7. Right. So Saturday at 2 in the morning, when somebody wakes up with severe shoulder pain and contacts our office in any way, Emily is on. Right. And, you know, Sunday all day long, Monday off hours. Our team works 40 hours a week. That leaves 128 hours a week when we're not manning phones, right? And in terms of bridging the gap between when somebody's in pain and they contact our office and we can have a conversation with them, and when our team member gets in, Ashley or Timber come in the next day to follow up, this does a really nice job of bridging the gap there. So team member monitors all the conversations, calls the patients when they're ready to schedule, used in both text and online ads for us. And I know many other owners are doing this as well. And it's built on the best practices of tens of thousands of potential calls, potential patient calls. You can see here from Joy, patient care coordinator. Emily has been amazing. It's managing leads because each conversation is 10 to 20 minutes and people take forever to reply. So I'm worried if I'm responding quick enough. With Emily, I'm notified if someone wants to schedule or if they're asking about insurance. She handles everything. I couldn't imagine another way of doing this job. So get hand raises. We talked about, I showed you Claude there, quick exercise of how you can use automation to speed up your process. No more excuses about having to reinvent the wheel every month with your marketing content. Convert to an appointment, right? We talked about that. And by the way, hand raises can be with a single click of a button. The third thing that we can do is improve finances. And I'm going to go through this and then we'll bring the owners on that are available that are doing this right now in their practice. So consistency and better finances. We want to think about, how can we attract more of our best payers? Earlier this year, I was at an event, 20 large practices in the room. And I said, how many of us are doing something for reactivation? All the hands raised. We send out an email once a month or once a quarter, even worse, but we don't really know, we can't track what's happening. And I said, okay, I'm going to give you an idea of how you can improve your payer mix. Is anybody interested in that? All the hands went up. I'm going to guess that you're looking to improve your payer mix as well. So most owners are. So the simple and easy way is you can segment your list, right? So you could email, text, one-on-one or one-to-many your best payers. So if our best payer is insurance company B, which could be Blue Cross or Blue Shield, right? If they're our best payer, yours may be different, but we could segment our patient list and then market more heavily to those patients. That's one way of many that we could attract more of our best payer. We can also do it with partners. We can also do it with cold traffic, right? I don't really have time to go into that now, but that's 3 different ways you can improve your payer mix with your marketing. The second thing that we can do is, how can we have more patients buying cash service? What we're going to do later today when we do our sessions on cash service is we're going to talk about 3 ways that you can promote. Number 1 is to existing patients. You should absolutely be doing that. You can make it part of your new patient email sequence, right? So you can ask your therapist about laser, ask your therapist about shockwave, ask your therapist about run DNA, ask your therapist about NewFit, whatever cash pay services you have, you can have it part of your new patient sequence, which is exactly what we do. The second thing that you can do is you can promote it to your past patients. Those same emails that we just created, I showed you saw on my screen that I made an email campaign for NewFit, right? Which was 3 emails and 2 text campaigns. So you could be doing that. The third way that you can promote it is you could go cold traffic. That is the hardest. I would not start there. I would start with the first 2. Your patient list is a gold mine for buying your cash pay services. And then how much does an unfilled schedule spot cost the practice? So in that previous example, right? When we're talking about these peaks and valleys, if a practice averages 60 new patients a month, but drops to 45 new patients a month in their slow months, what is not solving that costing them? So we're going to do a pop quiz, business math. Go to the chat right now and just write in your guess for what that would cost to practice. If you're at 60 visits a month normally, 45 new patients in your slow months, what is not solving that, costing that, our hypothetical practice here? Chris says 15K. Steve says 30K a month, 15K a month, 30K, 30K. Is that 20,000? 15K a month, that is low. Fixed costs 15K, 15K. So for most of us, the first 45 or, if we're running a 15% margin, the first 45 to 50 new patients that we see in a month are just covering our cost, right? So that those extra 10 or 20, 10 or 15, that deficit is really our margin for most of us. Right? So if we're doing 15 new, here's how you could do the quick math, 15 new patients a month. If each plan of care is worth $1,000, that would be $15,000, right? So $15,000 in margin we're missing out on. And in this practice, we're likely going from zero margin, break even, or even losing money to having $15,000 in profit. Pretty big deal. Now, if your plan of care is $2,000 average plan of care, then great, then it's 30K, right? So very quick, easy math of what that is costing a practice. Pretty big deal to solve. And personally, what it's meant for us, I've gone through this. I've shared this many times, but back in 2007, lost $43,000 in a quarter. So that was, we went single site location, 154 new patients in a month, 106, 66, October, November, December. Brutal, right? Had to let marketing person go, had to really tighten the reins, but lost income minus expenses, $43,000 in 3 months. Brutal. You would have thought that I would have learned my lesson. 2 years later, did the same exact thing. This one much more painful. Lost nearly $100,000 in 2009. And I remember just taking a step back and saying, hey, this is crazy. We're getting beat up every single year. What can we possibly do? That's where we came up with the GPE. So we looked at those 5 new patient pathways. Where can we double down? We came up with double down with our past patient list. Cold traffic, I have to compete with Kohl's and Target and Hobby Lobby and everybody else who ramps up their holiday, end of year, beginning of year spend, right? They're advertising very heavily. Couldn't compete with physicians. They have too much white powder flowing into their office with sugar and flour in terms of baked goods and personalized Hershey chocolate bars, which we have here in Central PA, and all this other stuff. Could not compete there, didn't want to double down. We could double down with our patient list. What we did that year is we ran the promotion in 2011. We created a wait, and it was November 4th was our event. We created a waiting list of 73 new patients that were all reactivations that took us 7 weeks to catch up on, right? So ran us through January of the next year. And what do you think that meant for our practice? You can guess on that one in the chat as well. The number that I really want to share with you, because I added it up since 2011, is unbelievable, but let's just go with 2011. What do you think that meant for us? Rather than losing $100,000 in a quarter, we were positive. What do you think that swing was? Yeah, better cash flow. We had much better cash flow. The number was $200,000. So at this time, would love to bring on the real life owners, Dee and Brian, if you can help me out here. Real life owners that are doing this right now.
I know we've got Lindsay on. I can add her.
Yeah. So Amy, while you're adding Lindsay, what about staffing that increase? Most of us are not according staff, right? So I don't, we have underutilized schedules more often than we're, right? So we're paying an expense that isn't really realized. And the way to think about it is go to last month. So we're now in October, go to September. If you would add whatever the number is, 5, 10, 15 new patients to last month, would you have had to employ more people? For most of us, the answer is no. Right? Like we could have figured out how to add those people in without increasing our expenses. All right, we have Andy. How you doing, Andy?
Hey, pretty good, Chad. How have you been doing?
Great. Can you introduce yourself here to everybody, who you are, where you're at in the world in private practice, how long you've been in private practice?
Of course. So myself, Andy, and I'm the registered physiotherapist and clinic director. I've been a physiotherapist since 2014, and my wife is a registered physiotherapist as well. We own and operate one of the four of the largest outpatient multidisciplinary clinic in Eastern Toronto, in Eastern GTA. Our flagship location, Whitby Physiotherapy Sports Rehab, that's right there in Whitby. And I have other 3 locations, one in Pickering, one in North Oshawa, one in Curtis. So total, I oversee over a $6 million operations amongst 4 clinics and oversee 60 staff members. And I won't be able to do it without Chad and his amazing team's help through Breakthrough. Yeah.
We'll get there. We'll get. I know you're super excited because of the George Springer 3-run home run last night, right?
Oh yeah, we had to pop some beers for sure. But yeah, we are happy for them.
Very nice. Awesome. Thanks for being here, Andy. And Lindsay, if you can do the same and introduce yourself to everybody.
Yeah, I don't know that I could top that introduction, but my name is Lindsay. I am the marketing director for a physical therapy practice in Southeast Michigan called Plymouth Physical Therapy Specialists. We have 28 locations, so I've been with the company for 13 years and grown within it from external marketing to internal marketing to now marketing director and overseeing all the layers of marketing. We've got multiple directors with the company, so a lot of voices, a lot of people in the room, and it's been really rewarding and fun and collaborative. And just being able to try new things has been a great thing for our practice. So I love all the new features that Breakthrough has thrown in. The AI features are the big ones that me and my team are utilizing a lot right now. And I'm really excited for just the state of PT when it comes to marketing and how we can continue to grow that. We've seen a lot of great things so far for our practice.
Nice. Did we lose Andy? It's okay.
No, I'm here.
Okay, great. Cool. So yeah, talk about Andy for like how you're using Breakthrough, how you're using AI automation technology within your practice. I believe you're running workshops, and then you're also doing reactivations as well. Can you talk about that and what that's meant for you?
Oh, of course, Chad. So I think we pretty much maximally utilizing the Breakthrough platform. So we're using it both ways. We're doing workshop events. So what we've been doing every month, we have different topics, right? Let's say rotator cuff or low back pain, or even modalities such as laser and shockwaves. So with those kind of workshops, let's say if we're planning a workshop a month later, we're starting the Facebook ad campaigns on them within the neighborhood and the community. And we're getting a lot of warm leads out of that. And then once the lead comes, right away, my admin team is kind of trained to kind of call them, convert them. And also we're using AI a lot. Emily does fantastic job for us. We've been using the automated text campaigns from them. So many of the leads, they'll book themselves right there automatically. That's giving them a response through the AI component of Breakthrough. They start chatting, and many of them, they confirm the attendance, or my team also booked them prior to the workshop. So let's say we've been doing this for now over 4 months. Every workshop I have had over 40 attendees, and we convert at least 50% of them on spot right after the workshop. So right there in a single day, you're getting 20 new assessments books for this and next week. Also, we'll be doing text and email campaigns as well. We've been doing 2 text campaigns a month and 1 email. As you just said in the beginning, that right away you got over 200 response. When we started our first text and email campaign, we pretty much got over 175 responses. And my team, I have 2 full-time admins all the time. And they were like, Andy, like, we have all this new leads to follow up. We have 175 responses to do, but then we had automated response from AI based out of Breakthrough, which really helped us convert those. So that's how we've been doing that. We are not waiting for patients to come. We going out there loud and all about running workshops, running existing text and email campaigns. Let's say I have over 20,000 patients. So those ones, when we send an email campaign or text campaign about, hey, we have a workshop about low back pain or sciatica, we getting over like 40 attendees out of the existing caseload. So as you just said, existing caseload is gold mine. You need to make sure that those patients you're utilizing the most, and now we're going out in community, reaching out and generating new leads through workshop. So we're killing two birds with one shot here.
What's that meant for your practice, Andy?
Oh, it meant a word for us. I think our sales went up 70% in last quarter. We pretty much one of the busiest outpatient clinic in Eastern Toronto right now. We clock over 200K a month.
Nice.
Just one location. Yeah.
Same question for you, Lindsay. But how are you using it, and what it has it meant for Plymouth?
Yeah. So for me, I mean, we'd already started working with, using Chat GPT and all the other the tools out there for writing and things like that. But once we started utilizing AI for workshops and for text campaigns, we saw it was a game changer for us because, we were part of the beta test with Breakthrough to utilize AI to, anyone who registers for a workshop. It was really nice that it had a really good conversation with the patients that seemed very real. And I think it not only was that helpful, but it was also helpful to take what we were seeing with those results and then implement them in other areas of our clinic. So some of the questions that Emily, our AI bot is named Lindsay because we have 28 locations, 18 of which are on with Breakthrough. And so I'm the common denominator that everyone knows. So if when we're doing text campaigns or whatever, if it says from Lindsay and if everyone has questions, they can say, oh yeah, she's in marketing. But we'll call her Emily for the sake of this. Emily, the questions she was asking were great. So I actually took a lot of those questions that we were getting and the feedback we were getting from patients and implemented those into new training tools for our recepts. It's been really helpful. We are actually implementing kiosks in some of our clinics. And so that's been really helpful because we don't have full-time recepts in those. We are actually piloting a couple different things where we have more of a centralized center for auth, center for benefits, things like that. And so I'm actually adding a new person to my team to help with calls, but the AI feature makes it pretty seamless transition. So we thought it might be difficult not having a recep on site for some of these locations and when people are calling in, but between the AI features and then our call center, it's actually been working out pretty well. Another feature that I really like, we've been using it for text campaigns, and we've been doing text campaigns for years now. And we like to do just like quick single question check-ins. But so we've tried that with a few of our clinics, utilizing Emily, and with really great results to the point where that's kind of what made me think, okay, I need to change it to my name because all these people were coming in and asking, oh, I want to speak with Emily. I just had a great conversation with her. People really responded well to those campaigns, and we got a lot of people off it. I think our Livonia office got at least like 14 new patients off of a single text campaign utilizing the AI feature. And it was nice because it didn't put too much strain on the director to actually respond back to all those text campaign or all the text messages. And it wasn't too much strain on the receptionist because they knew what was going on and it would immediately convert them to an appointment request. So they knew, okay, we got to track and make sure we're calling this person and doing the follow-ups to get them in for a consultation with us. I've since then taken that feature and I've used it for a couple laser open houses with really great results. I know we got 3 evals from one we just did last week, a bunch of other people coming in for laser at one of our other locations. So for me, it really does help. It takes workload off of the director, it takes workload off of me, and it makes things a little bit more organized. And then it's nice to be able to read through the chats and see what people are responding to, so then I can take that feedback and implement it in other ways with regards to training. But I'm excited. It's a new frontier, and I think, the more we implement it and play with it, I think the better results we're going to get with our marketing and hopefully save marketing dollars with it too.
Awesome. Andy and Lindsay, I know you're going to be on later here as well. Thank you both for being on, for hopping on here.
Yeah, no problem.
Okay.
Thanks for having us.
Right. So, yeah, just to answer one question, Joe, I know our team has answered. Yeah, we're going to, the entire day is talking about how you can use AI automation technology across the board in all four pillars. Right now, we're focused on reactivation and marketing. And quick poll coming up, when is your slowest season? Slowest month of the year, December, January, June, August, or other. If it's other, you can just type it in the chat. For us, it's December. All right, we're going to keep that up for another 5, 4, 3, 2, 1. And so December was 28%, January 43%. Quick math, that's 71%. June, August, we're another 21%, and then 8% other. So it seems like for most of us, December, January, at least 71% of us are December and January. So as we always do, today, entire day brought to you by Breakthrough. I am going to make an offer right now for those of you that are looking to fill schedules, fill space, to capitalize, make your slowest season your busiest time of year. So far this morning here, we went through getting hand raises, how to use AI automation technology to do that, how to convert over to an appointment with Emily, or you can name her whatever you want, Lindsay, if you're in Michigan, better finances. And then I'm also going to talk about my calendar. So there is a calendar that we use every single year to mitigate our slow season. And I'll share that here with you in a little bit. So I was thinking through this, how can I help the owner who's not looking to reinvent the wheel, who doesn't have time, who just wants to run steady, have consistency the whole year through? They want that solution for steady new patients coming in, but they don't have a ton of time in order to put together a system on their own, duct tape together a whole bunch of solutions and throw it on their team. So we're going to go through this right now. You're going to get an automated email and text campaign, unlimited AI conversion agent for 3 months, coaching and support to build your marketing calendar. And we're also going to talk about EMR integration. So automated text and email campaigns. We have tested copy already. We have an entire library of tested copy for text and email, what is working. Later on today, I believe Sarah is going to share with you the 9 or 10 best campaigns that are working the best out of hundreds, right? And you can send those with a single click within the Breakthrough software. You can customize the messaging for your practice if you want to. We highly recommend that you stick with the template that is in there because that's what's proven. But some practices like to have their own spin, want a word or two, that fits more of the tone, the feeling that they have within their clinic. So this gets your past patients to reactivate. It gets them to raise their hand. You heard from Andy and Lindsay how they're using it in their practices, and it saves you hours of time without having to write out a marketing email or text. This is already done for you. And there's even a little AI component where you can use AI to help customize to your unique brand, your unique practice. So you're going to get that. You're also going to get an unlimited AI conversion agent, Emily, for 90 days. So it's on 24/7. You can keep it on all the time. I know some practices prefer to keep it off between midnight and 8 a.m. We always keep it on because that's when people are in pain, but you can make that decision. Again, you can stick with the name Emily, as most practices have done, or you can customize it, whatever is appropriate for your practice. And it comes trained on your practice specific. You probably accept and participate with different insurances than I do. You likely have different cash pay services. You have a different market. Why does this matter? It's shown to cut your team's conversion time in all the practices that we looked at from 12 hours to 30 minutes, right? So that's a pretty big, more than a 90%, 94% reduction in time on your team. So if you have those empty schedules to fill, this is the way to do it, right? Get people to raise their hand and then convert them over to an appointment. A quick win here from Josh. We can never manage even a fraction of the conversations. Realize that Emily can have, multiple conversations going on at the same time. She's carrying on hundreds at once and doing so it naturally. and doing so naturally that people actually think it's me. That's never happened before, right? So again, this is not a chatbot from 2014. This is an AI agent that's deployed, that's trained on your practice to handle these patient conversations. And you can see here for Josh, now we're adding 10 to 15 trackable new patients each month. So what are we missing? What else could we include here? Well, this is what our calendar looks like for our slow season, right? We just shared this at a private event, and we do a lot, right? So we really double down right before our slow season so that we have tons of patients coming through. And the biggest one here that I want to call out is we're doing a text campaign every single month to our patient list and 2 email campaigns every single month to our patient list. And what that does is that creates an influx of new patients that gives us consistency all year round. We've turned December into our busiest time of year when it used to crush us. You know, is there anything else that we can do? Is this the best that we can possibly do? This is brand new. Nobody knows about this until you do right now. We are today integrated with Prompt. So Breakthrough is integrated with Prompt. If you are one of the 30, whatever it was, 30 to 40% of owners that are on Prompt right now, that is integrated. What this is going to do is save you a ton of time. Next up is Raintree. That is happening here in the very near future, like weeks, and then followed by the rest. Why does this matter? That, regardless of the results that Andy and Lindsay have shared, it saves time for your team, right? You're avoiding duplicate contacts and headaches. Right now, you don't have to have 2 separate systems. You have one system that is seamless and united. In the future, what is going to happen is Emily will schedule for you, right? Keep track of your patients as they're going through so you can treat patients differently. You can segment, right, by insurance type or by diagnosis, and also ROI reporting on the different marketing efforts that you have within the marketplace. So we have better attribution. 99% of the time when I'm talking with an owner, what are you doing for reactivations? What are you doing for cold traffic marketing? How well is that working? I don't know, right? Now you're going to know because it's going to be tracked in one streamlined, cohesive system that is talking, right? So what else is next? Every practice is different. We have different sizes. We have different needs, as you can see in the chat, different size of patient list. We're all on different EMRs. We're all in different markets, different states, different countries, locales, right? We have different slow seasons and we have different goals for our practice. So the only way to get this, and I know for most of us, it's like, oh no, hopping on a call. Here's what's really cool about this. So you're going to get on this call, you're going to see where your practice is at today. You're going to get super crystal clear on where your practice is going, what you really need to solve with regards to new patient acquisition. You're going to see what this will look like in your practice, and you're also going to lock in the best price for you. So this is Morgan. Morgan's been on our team for a while. I think he talks with like 200 private practices a month. He's known the industry. He's been in it for years. Morgan is great. This is the guy you want to see show up at your front door, to take your daughter out for dinner, right? Like Morgan is amazing. He's great. He knows the industry inside and out. He knows the right questions to ask you. It's going to be super valuable call for you. He will share what onboarding will look like for you. Like, here's what this can look like in your practice. You get to learn everything that you'd expect to know to get this launched in time for your practice for that upcoming slow season in December and January. And what you want to think about is in terms of getting the most out of your 15-minute call with Morgan, that discovery call, you're going to go into, what EMR are you using? The size of your patient list, have that. How many new patients per month you're at today, and really what is the gap? How many new patients per month could you handle? Number one profit margin killer in all of private practice PT is underutilized schedules. And it can be during a slow season. That's the most common when we don't have that consistency. So what to do right now to schedule your call with Morgan, go to the URL. It's getbreakthrough.com/growth. That's going to show up in the chat. That link will be in the chat, or you can scan the QR code with your phone. It'll take you to this page right here. You're going to click on a time to schedule with Morgan. It will be a 15-minute call. Again, you're going to show up with your EMR that you're using, the size of your patient list, where you're at today, new patients per month, and where you want to be, right? And also your slow season. So getbreakthrough.com/growth. Go schedule your call right now. Absolutely no obligation. So who this is for, it's for private practice owners only. You have a gap. So like Joe, I know you said you don't have a gap. That's fine. Great. This is not for you, but it is for owners that have a slow season, that want that consistency, that want, they don't have time to spend in marketing. They want to automate their processes, save their team's time so they can focus on other areas within the practice. They're serious and committed to growing their practice. You have a patient list that you can market to. So if you just opened up, right, and you have no patient list and you don't even have a friends and family list, this is going to be a rough run, right? So this is for an established practice that can market to their past patient list. And yes, there are a million other options that we have here. If you're a brand new practice, we do have other options. You can still talk with Morgan. That's fine. But this specific thing that we're talking about here is not for you. This is for owners that have an established practice. They have a patient list. They're not doing much with it that is measurable, and they want to have that consistency coming in from their patient list. How much does this cost? We have programs starting at $399 a month. Right now, there's qualifications around that. Again, we're all different, but this is like, if somebody calls you and says, I have back pain, how much, how many visits, how long do I need to come in for? Right? We're all different. There are practices on here that are just starting up. There are practices on here that have 60 locations, right? And everybody else in between, right? So it doesn't matter whether you're small, single site practice, single location, as long as you have a patient list, this program is going to work for you, right? If you have 60 locations plus, same exact thing. We have solutions around that as well. But the programs start at $399 a month. And yes, it does make sense that you're willing to invest to solve this problem. So again, what to do now? Go to getbreakthrough.com/growth or scan the QR code. Pick a time for your discovery call with Morgan. Go do that right now. And I will tell you, there is a real limitation here. I know Sarah would kill us if 30 people signed up, right? So, and I know that for most of us, December, January are coming up fast. And if we don't have a solution in place, it can be devastating for our practice. But yeah, so go do that right now. I know we have some limitations. We'll figure it out if it's over 30, but there is a true limitation there. Go there right now. Lock in your best price. The other thing that I want to share is this is a long time coming. I wish I got the cheat code. I didn't, right? And, for me, again, losing, and I remember the first time that I had lost over the $40,000 in 2007, I made this huge error where I shared this with my wife. I was like, wow, like, look at how well we're doing. We have all this reserve money as a token, like as a gift for Christmas this year. Why don't we give our families, we'll rent a beach house down in Outer Banks, North Carolina, and we'll take everybody down, right? Counted my chickens before they hatched, lost basically our full reserve, and then had to show up on Christmas Day. And unfortunately, my wife and I told our family, right, that we were going to do this and then could no longer do it. Felt like an absolute failure. So getting the solution has been a really big deal for us. Now every year we get, the home down on the beach and take the entire family down. That's what it's meant for me. The other thing that I had shared, for our practice, that first year was a $200,000 swing. I calculated what it has meant for us over the course of the last 14 years. It is in the millions of dollars. I'm not going to share the actual number. It's kind of unbelievable, but it's been a really big deal for us to have that consistency of new patient flow in terms of employment, in terms of adding that next therapist. So Joe, I'm talking to you, when you bring that next therapist on, a lot of us, are not confident in filling their schedule. We have somebody that's joining our clinic here later this year in one of our clinics. They have a full schedule already. They're going to walk into a full schedule of 50 to 60 visits a week today, right? That's the kind of consistency that you're looking for so that you can have that predictable growth. That has been huge for us as we go to open our de novo clinics, as we go to expand our existing spaces. We can go forward with a lot of confidence knowing that we're going to fill that space with new patient flow and that that's not going to be the issue, right? So we can focus on other areas of the business. This is the same exact thing that I use and that the same as our other breakthrough members like Lindsay, like Andy, like everybody else that you're seeing here. So you get a huge automated shortcut without going through all that pain. The other question that we typically get is, this was pretty cool. I was on with an owner and the owner said, "Hey, can I shut off, I think it was MailChimp." And I said, "Well, yeah, like this." And they said, "Well, what about all these other things that I'm doing that are like duct taped together?" And I said, "Yeah, that's kind of the idea here is that you have one streamlined system." And you just saw this like wave of relief going on. And I was like, "Yeah, you can manage everything here. This was built for private practice owners, right? And it handles all of these things." Now, obviously, we didn't go through every single thing here. We're mainly focused on reactivations and what that can do. But yes, this is an all-in-one system, and we run all of our marketing through here. So all the other things that we didn't talk about, cold traffic marketing and workshops and going out with, having people promote us and having land. Yes, all of that is within the software. The main thing that most of us need, though, is, again, our number one most valuable asset is that patient list. We can promote to them to carry our way through and keep our schedules full during that typical slow season. And for most of us, that is a very big swing in income. So one streamlined system, one streamlined process that handles everything. Again, you have that link. It's getbreakthrough.com/growth. Go there right now to schedule. I'll open this up. I see a couple questions in here. Dee, if you can help me out.
Okay, yeah, we do need to bring Lindsay back up. We're running a little bit behind, but yeah. One quick question was just, could you explain quickly what the GP stands for?
GPE is greatest promotion ever. I wrote about it in our book, Killer Marketing Secrets, but it's basically a day of reactivation rechecks. Some may call it free exams for your past patient list.
All right. And from Danielle, most people can pick up that it is AI. Do you feel that patients enjoy this feature? Have you asked patients who have used it? And then kind of similar, do you feel like you are misleading patients, still having an internal struggle with AI pretending to be me? Someone also asked, does the AI disclose that it is AI?
The AI will disclose that it can. Most people compliment it, right? And like Lindsay just switched to, and by the way, like this is being used everywhere now. Like I went to pay Easy Pass and I spoke with an AI. That was not a chatbot, right? Yeah, so more and more acceptable. We see a lot more compliments than any sort of upset. In fact, in our practice, I've never seen an upset minus somebody who was out of state who happened to register for one of our events. But other than that, it has been completely positive. And the other thing that will happen most often is people will thank Emily for taking the time to hear my story, right? They'll thank it. And then in our situation, and we'll have Lindsay on to do the same thing, she can answer this question probably better than I can. But for us, Ashley and Timber say, most often when they have that human contact, that phone call the next day, that person's pretty thankful that they were having a communication with somebody. Yeah.
All right, we had a question. Does Emily have options to send email campaigns to selected patients?
The platform does, yes. So yeah, there are practices that will segment out by insurance. We've done this internally, but you can send email campaigns out. That in terms of responding via, I know the engineering team is working on that right now. where Emily will also respond to emails. Yes.
Had a lot of questions about EMR integration, just people calling out specific platforms. Can you speak to how we're prioritizing those integrations?
Yep, I know Prompt is next. I know there's 3 phases of that, and you're going to get updated on that later today. I know Raintree is next, and then everyone else. I mean, it's going to happen based on prevalence in the market. I mean, would be the the number of owners that we want to help the most people, the most owners. So there's going to be a prioritized list. I can't share that with you here today, who that is. I know Jane is on the short list, Andy.
All right. How does Emily's performance compare to a human?
This is scary, but it's better. And so most practices, and I had this in a slide, then I took it out, but most practices focus on scripting, like what I say. We're the premier rehab provider. These are our certifications. You're going to love Joe. Like they focus on the declarative things of what they say. We know from data and studying that is not what works. What works is mirroring, like making the person feel heard, and then asking a question. The conversion rates are nearly double. And again, Emily is available 24/7, are nearly double human counterparts. The other thing that's happening is the human gets overwhelmed, right? So from all the data we've ever had, it is very easy to get distracted if you have somebody at your front desk or somebody that's not fully dedicated to this. That is, it's cost inhibitive to most of us. If we're paying somebody $20, $30 an hour, that really is, $35, $40 an hour in cost when we add in benefits and their office space and everything else. That becomes cost prohibitive pretty quickly.
All right, we've got Carl in. He's going to be answering some people's questions in the chat, but I got one more for you, Chad, which is how much work is this going to be setting up, getting started on the software, setting up Emily going to be for me and my team?
Yeah, so we, as of right now, for owners that are fully engaged, it's 3 calls to get up and running. Really, you could send your first email and text campaign in 1 call. But in order to work out all the kinks or anything like that for your practice, I'm going to say that it's less than 3 total hours to get up and running. There's work involved, but it's the way that I think about this as a business owner is what is this worth to me? If I'm losing money or I'm about to have a month or 2 where I can't take a paycheck out of my private practice, and it's going to be tight, especially around the holidays and the new year, then this is going to be something fairly important for me to solve. So can I carve out 3 hours to get this in? I would do the cost benefit analysis that way. That's how I would think about it. Eric,
I can jump in on some of the questions about integration or anything technical that wasn't addressed, but I don't know that I'll be able to navigate them all. HIPAA concerns, it's a concern. However, we're following all the proper steps to be HIPAA compliant and have been audited. So the whole thing is HIPAA compliant. If you can leave up, Chad, I was just going to say, if you can leave this up, that'd be a good thing to do. We'll actually have Mary on later who you could ask more questions about this, but we are HIPAA compliant. I'm going to try to rip through rapid fire for you guys here just because we don't have a ton of time. If you have any specific questions about integrations, what the integration does, I saw some questions about like with Prompt, how do you best use it? How is it going to manage overlapping things? You're going to want to schedule that call with Morgan, and he's going to be able to get you connected with the right person to address that. We did just complete our integration. I see like the question about Mark, with Prompt, but we haven't with the other EMRs just yet. That's our first one. And we are going to be working forward here to with others one by one, just like Chad said. I'm not going to get into detailed timelines on those, but that's just a big benefit. Right now, it'll work it works great for many practices, one by one without, the integration connected. It just is going to make it more efficient, and eventually get to the point where we can actually have Emily put people right on the schedule. Was there anything else here, Dee, that I should cover that you can remember? I'm trying to scroll through. There are so many questions.
I had a question from Stephen about minimum monthly revenue requirement for, bringing on new clients to Breakthrough. I.e., do you need to be making, $50K a month before you will take on a new client?
I don't know that we have a requirement for this product at all. We don't really talk about that.
Okay. Is there an additional cost to implement the integration with the EMR?
Good question. There will be at some point, but those joining initially will not have one, because we're going to be having those who are joining early helping us to work out the best, to make it the best and easiest to use and get you the best results possible. So yeah, like anybody who's joining before the end of the year will not have an additional fee, but eventually we will have one. So I would just recommend anybody who's on here, if they want to see this and see how it works, schedule your call with Morgan. You'll have the chance to chat with Emily herself and see how it goes, how the conversation goes. I did see that there was some questions about, like, concerns about, using it with patients and is it weird and whatnot. I mean, I think that once you get to use it yourself, we did this at first in a boot camp at an event, a live event. We had to text everybody, and literally 90% of the room after they tried it was, actually more than that, almost the whole room was basically ready to go because they were comfortable with how it handled conversations. So put a lot of time into it, a lot of training. And I think you should just try it for yourself. Like, schedule one of these calls and you can play with it a little bit. Yeah, we can move on from here probably to the next session.
Great. I'm going to make an executive decision here.
I do see Lindsay. She's raising her hand. So
great. So let's bring Lindsay back on, and then I know she's been on for a few minutes already. We'll circle back with this. We did have one other question that came in from Dr. G while Lindsay's coming back on, but how important is integration? The way that I think about this as an owner is it's only going to make things better, right? So less work, more time savings, more efficient, more effective long-term, but we've been running for Breakthrough for 10 years without integration, but it's going to make it better in the future. You don't need it today to get started.